Hello everyone, myself Shanaz and I welcome you all to my channel Nurses the Heart of Healthcare. If you are new to this channel, please subscribe Nurses the Heart of Healthcare. In this video, we are going to learn about one of the serious life-threatening medical emergency, that is brain stroke. Brain stroke, which is also known as CVA, cerebrovascular accident, and sometimes also called as brain attack. Whenever we receive a patient in an emergency of a hospital with suspected brain stroke, that patient is given priority over the other patient. I mean, the team of doctors and the nurses give priority to attend that patient first, then the other patient. And code stroke is announced in the hospital so that all the departments involved in its diagnosis and management prepare themselves to receive this patient, like for example the CT scan department, the MRI department, the ICUs, the labs, everyone. Okay, so they have to give priority to this patient. Why is it so? Why brain stroke is a medical emergency? Why code stroke is announced in the hospital when we receive a patient with suspected stroke? And 29th October is observed as World Stroke Day, and the month of October is observed as Stroke Awareness Month. So why the brain stroke is given so much priority? Why is it so important to diagnose and to treat the patient promptly, okay, to save the patient's life and to minimize the brain damage? So let us, to understand these things, we got to understand few facts related to our brain and few facts related to brain stroke. Okay, so let us see what is that. Now, as we all know, what is brain stroke? Brain stroke is nothing but sudden onset of symptoms which occurs when blood supply to certain part of the brain, any part to certain part of the brain is blocked or reduced. Okay, then what happens? The cells in that part of the brain, cannot function properly and they start dying within minutes. Okay, and then they die, eventually they die, okay, within minutes. So that is called, and the symptoms that arises is called the brain stroke. Okay, so brain stroke, whatever is the reason of the brain stroke is a medical emergency. So let us understand some facts related to our brain. As we know, it is a vital organ of our body and it is the control center of our body. Okay, so brain is an organ. It's not a muscle, it's an organ which controls all the other muscles of our body. Okay, so brain, which is the control center of our body and which is protected by the skull, it is very sensitive and vulnerable part of our body. Okay, so brain, like any other organ, is made up of cells and the tissues. Okay, so brain is made up of brain cells, and those brain cells are of two types, that is neurons and the glial cells. Okay, so the two types of cells that make up the brain are the neurons and the glial cells. So a study shows that our brain is made up of about 86 billion neurons and as many glial cells as neurons. Okay, so neurons are the most common type of brain cells, or we can say that neurons are the fundamental unit of brain. Or in other words, we can also say neurons are the building blocks of brain. Okay, so which are very sensitive and vulnerable. So neurons and glial cells all together, they form our brain. Okay, so neurons, as we know, there are different types of neurons that we have learned. That is sensory neurons, which collects the information from the outside environment and pass it on to the brain. And then we have motor neurons, which carries the orders from the brain to the outside environment or to different parts of the body, and we have interneurons. Okay, then glial cells are also of different types. Now these neurons and glial cells are like bodyguards of the neurons. Okay, they protect the functions of the neurons. So these neurons and the glial cells, they are very delicate, and especially the neurons, they are very sensitive to the lack of oxygen. Okay, so the neurons are very sensitive to the lack of oxygen, and whenever actually our brain, see, these are the different brain cells that form our brain. Okay, so whenever these neurons, they are very sensitive to lack of oxygen, our brain is powered by glucose and oxygen, which is supplied by the blood. and failure to supply this oxygen and glucose to the brain cells causes brain stroke. Okay, so our brain cells, they utilize a lot of energy, a lot of oxygen, a lot of glucose when they are active. Okay, and they are very sensitive to the lack of oxygen. So if because of any reason, if the blood supply to these neurons or the brain cells is cut off or reduced, they become damaged and they start dying. Okay, and once they die, we cannot bring them back to life. Okay, it is an irreversible damage. Okay, so these neurons are very sensitive to lack of oxygen. That's the reason it's very important to treat the patient, to diagnose and treat the patient promptly. There is something called golden hour that you all might have heard of. Golden hour is the first 60 minutes from the onset of the symptoms is called the golden hour, and it is very important that the patient of brain stroke receive treatment within this 60 minutes, so that to minimize the brain damage as well as to save the patient. Okay, because if the brain gets damaged, it leaves the patient with long term disabilities, okay, which can be cognitive and motor. So we have to be prompt to diagnose and treat this condition. Okay, so time saved means brain saved. So when it comes to brain stroke, it is time is brain. Okay, so time saved is brain saved and time wasted is brain wasted. And especially the first hour, which is called the golden hour, is very crucial when it comes to stroke patients, so that there are better chances of survival and to avoid the long term brain damage and disability. Okay, now why is it important is, see, this is our brain. Okay, so whenever because of any reason, either because of the blockage in the artery of the brain or because of the bleeding in certain part of the brain, what happens is the blood supply to the part of the brain is blocked or hindered. Then the cells become damaged and they start dying. Okay, so once they die, this is called the core. Okay, where the brain cells, the blood supply has completely cut off and these cells have died. Okay, so the infarct has been established. This is called core, and this is called penumbra. Penumbra is the area of the brain where the blood supply has reduced, not completely cut off, it has reduced, and this area is salvageable. These cells are salvageable. Means if they receive prompt treatment, if reperfusion is done soon, then this area can be saved. Okay, so this is called core and this is called penumbra. To better understand this, we can take an example, like for example, you have witnessed an accident on the road, okay, wherein you are seeing that there are 3 people in the accident and 1 died on the spot and 2 are severely injured. Okay, so the person who died in that accident, we cannot bring him back to life. Yes, but at the same time we cannot sit there and mourn, because there are 2 other people, who are severely damaged, but still they are not dead. They can be, if they are taken to the hospital fast, we can help them survive. Okay, so that two people are like penumbra here. Okay, so we are hurrying it and we are doing it fast so that we can save this area, penumbra, from converting into core. Okay, so this area we cannot helpless. Okay, we cannot do anything because the cells are already died here and we cannot bring them back to life. But at least to save this area and to prevent it from getting converted into core, we are prompt diagnosis and treatment is necessary. Okay, so that's why brain stroke is a medical emergency where time is very crucial. Time is the essence. Okay, time is brain. When it comes to brain stroke, time is brain. Okay, so this is, as we can see here, in 1 minute the stroke goes untreated. We can see that, see, in 1 minute if the stroke goes untreated, about 1.9 million neurons, they die. Okay, we lose 1.9 million neurons, and every hour the stroke goes untreated, we lose as many neurons as that we can lose in 3.6 years of normal aging. So that's the reason brain stroke is a medical emergency and time is very crucial. Okay, so in 30 minutes see the damage, in 2 hours see how the damage is increasing, and in 12 hours it has in fact a big area has infarcted which cannot be brought back to life. So it's very important, time is very crucial, okay, in brain stroke. Then the other fact related to our brain is our brain cells, they do not regenerate, they do not multiply. Okay, like for example, you see when we get a injury, okay, to our skin, when we get a cut or injury to our skin, what happens? The skin cells, they multiply, okay, they keep dividing, okay, and then they form a bundle of cells to heal that injured part. Okay, see here is a cut, a bundle of cells are formed, okay, then after all the processes that area is healed. But when it comes to brain, it is not the same. Okay, whenever the brain damage occurs and the cells die there, that area is, it's a irreversible damage, we cannot get that area back to life. Okay, so that's the reason it's very important medical emergency which has to be treated promptly. So stroke is a medical emergency and time is brain. 1.9 million brain cells die each minute the stroke goes untreated. Okay, so our time window for treatment of stroke is 4.5 hours. Okay, so we have to try our best to take the patient to the hospital within this time and make sure that the patient receive immediate medical treatment, okay, or treatment as per the type of stroke and the cause of stroke. So this is very important for us to understand regarding the stroke. When it comes to some facts related to brain stroke, if you see the global burden of brain stroke is the second leading cause of death, okay, worldwide, and third leading cause of disability. Okay, as you can see here, 1 in 6 dies of stroke in lifetime. Okay, here we can see the world statistics and here we can see the India statistics. Okay, so 1 in 6 person get a stroke in his or her lifetime. Okay, so stroke, 80% of the strokes are actually preventable. Okay, we have to know the risk factors and change our lifestyle according to that. And stroke, the risk of stroke increases with the age, but one fact is stroke can strike anyone at any age at any time. Okay, so this we have to know very well. And when it comes to stroke is in stroke every minute counts. Okay, so time saved is brain saved, time lost is brain lost. So when it comes to stroke, time is brain. Okay, so hope this video has helped you in understanding why stroke is considered as a medical emergency and why prompt diagnosis and treatment is necessary. Okay, so if you like the content of the video, please subscribe my channel Nurses the Heart of Healthcare, like and share my videos to motivate me. Thank you. Stay connected.